Yes, indeed, studies have been published to show that the use of blood thinners or anticoagulants can reduce the risk of dementia in people with atrial fibrillation. So specifically, uh, so 10 or 15 years ago, when we didn't have the newer generation of blood thinners, so patients were using warfarin, also known as Coumadin. Those patients who were taking warfarin at an appropriate dose, and their blood is appropriately thinned out, they have lower risk of dementia compared to those who are not taking warfarin at an appropriate dose. So subsequent studies using the newer generation blood thinners have shown that when patients are very compliant with those medications, their rates of dementia are lower compared to those who are not compliant or not taking this medication. So clearly, if we can effectively prevent small little clots that may not result in a big stroke over time, that can reduce the risk of dementia. There are some reports of procedures known as ablation that patients with atrial fibrillation may commonly undergo, that if the ablation is successful in preventing atrial fibrillation, that might result in a lower risk of dementia, but the jury is still out on that. More studies will need to be done to validate and confirm those early findings.